which is a really good time, in actual fact, because she's been listening to all this, to introduce our review of the week with our favourite Member of Parliament, the Labour MP for Tairi, Ingrid Leary. Good morning to you, Ingrid. Welcome to the show.
Good morning. Thanks,
Did you ever leave your kids alone? Did you leave your kids alone at home?
I have done, when they're sort of 14, and I absolutely agree that even 14, I don't think my oldest boy, I'd come back, the place would be, I just didn't know how he was able to achieve all of that carnage so quickly. And with my girl, if anything, the house was tidy when I got home. So,
yes,
I don't know.
Yes, yeah. Same. And there'd be a meal waiting for me if the girls were home. But with the boys...
Yeah.
No, I agree. Hey, now, what about this teacher strike? Let's start there. Prime Minister Chris Hipkins on our news at 12 o'clock and saying that when he was Minister of Education, I don't know if it was a dig at, who is the Minister of Education now? Is it?
Jane Tinetti.
Oh, right, Jane Tinetti, that's right, because she is a primary school. Well, she was a primary school principal, I think, wasn't she?
Correct, yep. She was a teacher and then a principal.
I mean, it was reported that way. I'm sure he didn't mean it, but it seemed like Chris Hipkins said, well, they never struck when I was Minister of Education. But he said that they've never been given such a generous offer as they've been offered. Why are they striking, and do you have any sympathy for them, Ingrid?
Look, I think this is quite similar to the situation we've had with the nurses. A couple of things. It is a very female-dominated sector, and so traditionally I don't think the pay rates have reflected the value of the work. But secondly, under Labour governments, we know that these sectors do get pay rises, so I guess part of that process is they kind of rattle the cage a bit more because they know that this is part of what happens with bargaining, and I wouldn't want to comment when bargaining is still happening, apart from to say, I think that an outcome will be reached. It was reached with the nurses yesterday. There was a huge announcement around, finally, the poor nurses, that, it's been a long and slow process for them, and I have a lot of sympathy for their situation. But the good news is it's got resolved, and I'm confident that it'll get resolved with the teachers as well.
So you think the strike is just part of the bargaining process, which means if you think that way, Ingrid, and I'm sure you're right, that really these kids are being used as pawns in a struggle between the Ministry of Education and their masters and between the school teachers. I'm sorry, but that doesn't paint anybody in a particularly good light, does it?
Look, I think that the teachers are very frustrated, and that has led to the strike, and I wouldn't want to comment on that. There is a process, and striking is something, I'm sure that they do have the interests of the kids at heart, and to get to a point where you need to strike, that shows a deep level of frustration. But I think we are in agreement, as you said, that part of what happens when bargaining breaks down is strike notices and strikes. That's how our employment and collective bargaining system works, and that's what's happened in this case. So it's unfortunate, but as I say, I think there will be an outcome, and hopefully it will be without further strikes so that the kids aren't caught in the middle.
Well, I mean, it's ironic, really. I mean, 3 years of disrupted learning, which is, as you and I know, particularly with boys, led to some pretty unfortunate educational outcomes, and here we are having another interrupted piece of learning in that week. Ingrid, but we haven't talked for a while, so the good news is that the last poll yesterday, the Taxpayer Union Curia poll, puts Labour back in the lead, slim but nevertheless leading. Chris Hipkins has made a hell of a difference in terms of public perception in the 5-6 weeks he's been Prime Minister.
Is there a question?
Well, no. I agree. I'm interested in your response to that.
He's made I think there's a number of factors. Clearly, he is coming across as somebody who is calm and centred and able to handle a crisis, who is able to dial back the focus to bread and butter issues, which has obviously landed really well with New Zealanders, and can handle, the weather events. I mean, it was just bizarre that there were so many catastrophes that happened under Jacinda Ardern's leadership, and she showed, a fantastic leadership in that space. I thought, well, perhaps some people are, this is a bit unfair, but there's a magnet for crises, and perhaps with a new leader, we can all heave a sigh of relief. New Zealand won't have any more crises. The following week there was the weather event started. So, we're in turbulent times, and Chris Hipkins has shown that he's a very safe, stable pair of hands who's listening and who is taking us back to basics, and I think that's making a difference.
I guess it means that you've got to sort of dial back some of your ambition if you're on the left of the party. You're comfortable with that?
Yeah, it's all about timing, isn't it? Now is not the right time to be overreaching when we need to make sure that we handle the basics, which is around, the regions that have been hit really badly, and that we also take people with us. And I was one of the people in the caucus who was openly saying, I think we are doing too much too quickly. I advocated quite strongly on that, particularly around some of the changes in the rural sector and the farming rules. And, we saw some wins with that, with the winter feed time frames being extended and so on. So Chris Hipkins clearly heard that message from many of us in the caucus and has dialed it back. And I think it's where he comfortably sits politically as well.
You've also described yourself as being on the left of the caucus, but you're clearly relaxed about where you are at the moment. Does that mean, this is going to be a really closely fought election, you can see that. There's almost like a cigarette paper between both the centre-right and the centre-left. But I wonder if between National and Labour there is a sort of, you get the feeling from an outsider's perspective, a sort of coming together. You're both sort of heading for the middle ground, whether from a position of being centre-left or a position of centre-right. That centre, it's where the election's going to be fought and won, yeah?
I think the election will be fought in the centre. I don't necessarily think I don't agree with your analysis. It's razor thin currently, and we clearly have a lot of work to do, and we don't take anything for granted. I do think that the longer the opposition fails to come up with credible policies that will work, and a suite of them, and until they come up with a much clearer plan and a vision, I think that gap will increase, and that you will see us nudge ahead. As I say, I'm not taking it for granted, but I haven't yet seen, clear policies that are costed well, that will work, that have been thought through. And so, bring it on. Let's see what National does offer, so that we can have a really good nationwide debate around the policies. That's what I'm looking forward to. And so I kind of think they need to hurry up.
That matter, the other sector that's in some sort of flame, in fact much more of a flame than education at the moment really, is health. As you know, Te Whatu Ora was set up to try, and I had a bit of a rant about that this morning because I was saying how bad, as an elected district health board member, the old health system was. We had a really good health system in the 1960s and 70s and then changed it around, and it's all gone to pot since. And really, in many ways, Te Whatu Ora is dialing back to that time period of having a central agency and having some form of central planning, and rather than the sort of plethora of stupidity that district health boards were. But I have to say, there are a lot of teething problems at the moment, you'd have to say, Ingrid, particularly around emergency department. Yeah, carry on, sorry.
Yeah, look, and the Minister acknowledged that yesterday in the House. It is a very big ship to turn around, and I think that the new Minister has shown a clear commitment to listening, to acting decisively, which is what you need. With a big ship like this, you need to have decisive leadership. And I'll say this as a backbench MP, this is my personal opinion, that the Ministry is not known for being the most workable ministry. They have in the past often seemed to have a mind of their own, and clearly Aisha Verrill is putting her stamp of leadership on this ministry and requiring a certain level of compliance around the rules, around making sure that information is correct and so on. And, yesterday she said in the House, as soon as she saw that there was some misinformation on the website, some incorrect information, getting the officials in, requiring an explanation, receiving an apology. That's a real mark of leadership that I think is going to make a big difference. And I think we will see some faster progress. Certainly I'm very happy with her response around the Dunedin Hospital. Day 2 of the job, she was down in Dunedin in the hospital project building, discussing, looking at the plans, speaking to the clinicians group and really putting her ear on the ground to say what is happening here and what do we need to do to make sure that this is going to be the state-of-the-art hospital it needs to be.
I understand that from a personal point of view and certainly as a constituency member of Parliament, but it seems to me you've identified the problem there. You've set up Te Whātau Ora as essentially the operational wing of the health service or the public health service. But does the Ministry of Health still have an overarching role to play there, does it?
No, Te Whātau Ora is the one, is the body, if you like. I think the question, for me, there is a famous saying from Peter Drucker in management, the culture eats strategy for breakfast. Cultural change will come with structural change, but it takes time. And so the fact that there has been a complete change in the structure, I think, is really good. And now we need to see the cultural shift within the ministry to go back to a centralised model and to actually, work without those layers of bureaucracy in order to get, I think, better communications. Comms has always been an issue in the health sector, in my view, in my personal view, and also to see the resources used at the coalface rather than through the layers of bureaucracy, which is what we've seen before. And I think the real issue is that New Zealand doesn't have the economies of scale to have a multiplicity of health boards, as you've quite rightly identified. And what we need to do is look at centres of excellence and make sure that we can get people seen to quickly and efficiently. And that's why we need to have a centralised system, along with getting those really bad statistics around Maori health in particular changed so that we can have responses that ensure that we're getting the data and that we're reaching Maori before their health issues are too late to be able to get the interventions to them in time.
Can you explain then to me what the role of the Maori Health Authority is? Because I don't know what they're going to do. Now, you'll be much better equipped than me, but obviously there's been a fair bit of criticism that, wait on, you've hived off into Maori health here. Pacific Islanders' health is just as bad as Maori in this country, as both a cultural and as an ethnic group. So are they going to be looking after Pacific Island health and poor white health, for example, in a place like South Dunedin, where you've got a lot of poor whites as well too, Ingrid, who have exactly the same health outcomes as Maori folk do? Who's going to look after those people, or is it you're just going to look after Maori?
Te Whātau Ora's remit is to ensure that the health interventions are able to reach Maori and that sector of the community that has been completely cut out of the health system. And there's plenty of data to show that. I absolutely agree that we have other communities who have very bad poor health outcomes who haven't been looked after in the current system, and we have dedicated health strategies to them. For South Dunedin, yes, there are poor, deprived areas where people aren't getting the health outcomes, but I have to say that the level of governance and voice afforded to Pacifica in particular has been really worrying. And I think that's a really urgent need down here. And it's one of the things I'm doing as a local MP, is to say, where is our Pacific voice and what can we do to ensure that there are dedicated Pacific Health resources, and part of that is around actually having them have, a location and their own building and resource that they can work from, and where they can actually send out Pacific Health expertise into the communities and into the health system. That's happening to a small degree at the moment, but it's nowhere near funded to the level that it should be. And so my concern locally is around that cohort.
But hasn't the Maori Health Authority, Te Aka Whaiora, made that worse? I'm looking at what they're seeking to do there, and they want to, and this is their own words, embed Te Tiriti o Waitangi and the entire health system, at its foundation. Ensure that iwi, hapu and whānau can exercise tino rangatiratanga and their decision-making authority over matters of importance to them, and taking a Te Tiriti-based approach to identifying and tackling the issues and factors within the health system. Now, that's fine if you're Maori, but as you've just pointed out, if you're Pacifica and your health outcomes are bad too, that Maori Health Authority isn't going to be looking after me, is it? I mean, and I'm struggling to see why... Yeah, carry on.
Yeah, well, it depends on whether you accept that Māori have a particular partnership relationship with the Crown, and you and I have spoken about that before. The Pacific Health Strategy will address the Pacific Health inequities. The Māori health inequities overall are still worse from the data and the information that I've seen, but there's not that much between it. So, this is a treaty approach, and I guess that's a political difference between us as to whether we think there should be a distinction between those who are treaty partners to the Crown versus the rest of the population. But I do have to say that with all of that, we know that when Māori do well, and the outcomes for everyone are better. As a taxpayer, I don't want to be paying for premature amputations of legs in 20-year-olds because those people have experienced inequities that meant they haven't been able to access the social services and the health services that they need in order to not have that outcome. It's better for all of us. So there's some logic to it that's really compelling. And the difference, I guess, is Māori do have a Te Tiriti relationship and Pacifica do not. But they will be looked after, as will the other segments of the community, including women, through strategies that are dedicated to those populations in order to get the outcomes that they need.
It's just that I'm looking here at a report that was put out 5 years ago that shows that the average life expectancy of Pacifica in this country is actually less than Maori. And that's why I've been raising this issue about sectors of our society that would seem to be disadvantaged by taking this sort of co-governance model into the public health sector. Ingrid? So
I was at a funeral a couple of weeks ago of a dear friend of mine's husband who passed away far too early. I think he was 51. And it was in Auckland, out in Manukau, and I looked around the graveyard, and the ages on those gravestones was really, it's one thing to know this data, and it's another one to see a visible iteration of it in the gravestones where you see how young these people are for passing away in their 40s, 50s, 60s. There are inequities, and I think there's a lot of factors involved. I'm not an expert on that. Some of it, I feel, is also to do with non-communicable issues. We know we have a diabetes epidemic in New Zealand. We know we have poor housing and so on. So there are a lot of things at play, and there's a lot of focus from our government on making sure that we can sort those issues out because they all lead to health outcomes as well. I don't think we can look at the data just in isolation, but I do hear your point that there are a number of sectors in our community that really need a leg up, and that is what the health reforms are trying to achieve. You and I will always probably disagree politically and philosophically on whether there should be a particular voice for Māori. The data does support having it, and the Te Tiriti relationship, in my view, also supports that.
Yeah, I guess the difference to me is I'm not interested in talking, I'm interested in doing. So I just want something that improves the outcome of everybody who's got a poor outcome at the moment, irrespective of their age or ethnicity. Okay, moving on. Cyclone Gabrielle. We've had a lot of folk on, Ingrid, over the last 3 weeks who are living in the area from the Gisborne, Hawke's Bay area, dealing and coping with it. They'll be coping with it, as we both know, for weeks and months, possibly even years to come. There is one of the things that's come out of that is the inquiry, long overdue, I think you'd agree, into the forestry industry in that particular area and the particular problem of slash. Now, that inquiry is confined primarily to the East Coast. So I know in Hawke's Bay they're a bit upset about it because they're saying, don't exclude us. But I would think that you could probably make that answer here as well, or anywhere else where the forestry industry exists in New Zealand. Do you think forestry is running out of time or has lost its social licence to carry on the way it has?
I think you raise a really good point around the social licence. And clearly we need to have approaches to forestry that ensure that whatever happens with climate change is sustainable. And there's, a whole lot of evidence to show that we need indigenous trees rather than exotic trees and so on. And there has been policy changes to ensure that that's reflected. I think that the reason for having the narrower focus is probably to get some answers quite quickly, and then we need to look at what does that mean for the other regions and the overall approach to forestry.
Well, you see, I just don't know why there isn't, for example, why Stuart Nash decided to exclude Hawke's Bay. You've only got to look at the Esk River and the slash that came down and destroyed the Waiahiki Bridge and all through the Hawke's Bay. It does seem an odd decision. I mean, I know you don't like to criticise your ministers, but in that particular issue, I'm not looking at criticism. You might like to extend the inquiry, do you think, to other areas that were devastated by slash as well?
Yeah, so you'd have to speak to the minister about what his reasons were. When I look at it, I would say that this is about drawing some conclusions and some recommendations quite quickly, and the wider you make an inquiry, the longer it's going to take. But it has been really traumatic for those communities, and I think the first, they've lived with this for a number of years, but the first time this really came up quite strongly was just before Christmas. And nobody could foresee, well, they didn't foresee the extent to which the slash was going to become a massive problem. So there's some learnings for everybody in this, and I hope that we get some good, strong recommendations, and then we look across New Zealand to go, now, what does this mean for the sector? And we take those very seriously.
And finally, looking forward, you've got Grant Robertson's got a budget to prepare. Are you involved in that at a caucus level, or is this still something that's happening at a much higher sort of stratospheric level within cabinet committees and the like, Ingrid?
I think that it depends on what you mean by the question. We are always talking with our caucus colleagues about where the focus should be and what should be funded. The detail on the plan comes from the executive, but we feed in constantly, and I've been a really strong voice for trying to ensure that when we're looking at climate change adaptation, and when we're looking, which now I believe there is much more social licence for than perhaps even a few months ago, even though the people in South Dunedin have known this is an urgent problem for years. I want our community to be top of mind. I know there are pressing issues in the North Island and we need to respond. We are responding with, thoughtfully but with urgency. But when it comes to our longer term approach, I want South Dunedin front and centre of that as a pilot, and I've been really pushing for that. The frustration, I have to say, has been at the local level, as you know, Michael, about trying to get local authorities and local politicians to reach out. I think we're making some progress there, and I'm really hoping that we're going to see some kind of collaboration announced or happening and some visible signs of something happening here before the election, because it's been a talk fest for a long time, but the government can only respond to an invitation locally. So I'm still pushing very hard on that.
Well, thank you very much. I appreciate the time that you've given to us, Ingrid. Are you going to the Wanaka show, by the way?
I'm not. I wouldn't mind mentioning one thing which I thought your listeners might be interested in, perhaps not, but the UK-New Zealand visa scheme, that has been such a bugbear for governments over, I remember it coming up under the Helen Clark time, and I can't remember where I was working at that time, but it was very sensitive, and at one point the UK were going to even look at reducing the visas or eliminating them. Very, very sensitive, always made front page news. Well, today there's been an announcement that those visas will be extended in both directions. So New Zealanders going overseas will be able to stay longer, the age group's moved, it's extended, and vice versa. Those from the UK will be able to stay longer here now, which is going to help with our labour shortage, but also, a loosening of the parameters around it. And I think that's a great outcome. It was something that was negotiated under the UK Free Trade Agreement, but we weren't expecting any announcements till perhaps mid to the end of next year. That's all been pushed forward as a response to the weather event. So I think that's a positive thing to end an interview with. Yeah, it's really good news, and this is always
but really it's been pushed forward because of Cyclone Gabrielle. The Brits have felt a bit sorry for us. So they've said, well, why don't we just let our people stay over there a bit longer? Yeah, exactly. They've said exactly that. We've said, look, you've got young people here doing working holidays, are contributing. We need all hands on deck. Let's move the dial forward so that we can sort out the extension to the visa and make it practical. And I think it's just a great story. So just to get me this right again, because my daughter's sort of fixed up on this, and she's that sort of age where they're, New Zealanders in their late teens, early 20s, like to head off overseas. They could stay overseas for 2 years. Is that what they could do, Ingrid? Are you saying that that's been extended now? Or they could stay in England for 2 years?
Yep, it's 3 years. It's a year longer. And the age of eligibility has increased from 30 to 35 years.
Right, so it's 18 to 35 or whatever it is now?
Yep. I'm just looking I want to make sure I give you the right age. I think it's 18. Yeah, it used to be 18 to 30. It's now 18 to 35.
And you can now spend 3 years. So that means you don't need a visa to go to Britain. Is that right? And I can stay there for 3 years and work between the ages of 18 and 35 if I'm a New Zealand citizen, and vice versa.
Correct. So the extension is from 2 years or 23 months in the case of New Zealand to 3 years.
Right. That's very good. Yes, it is. That is a positive outcome.
The cap on the visas will be higher too. I'm just looking at it's up to 15,000. I'm trying to find what the number was before. But, it's just a general loosening. And all of this was preempted. I mean, this was part of the gold standard FTA with the UK. But I just think it's great that we've been able to move it forward from the end of 2024 or around then when this was all expected to shake down. Just bring it forward. It works for us. It works for them. Great news for young New Zealanders wanting to go to the UK. Not thinking I've got to panic because I might not be the right age or I've got to leave now after 2 years. I remember my sister, she was able to access a visa because she worked in a really poor area in Brixton where they were desperately short, and there were some rules where they were able to get different visas, but it was quite full on because she loved her job, wanted to stay there. She was able to stay. A whole lot of people weren't able to stay. Now that's been relaxed, and it goes both ways. And it's good when we're seeing the geopolitics playing out at the moment around the world with Ukraine, with what's happening with China, Taiwan, the US, and all of that. Let's have these agreements with our friends so we stay close to them.
And just remember, we've got this and the free trade agreement because of Brexit.
Well, that's a discussion for another day, Michael.
No, you have to concede that. This wouldn't be happening if Britain was still a part of the European community. It was as a result of Brexit that we're getting a free trade agreement with the Brits. We would never been allowed to have one before because the Brits were part of the European community. I mean,
Yeah, but we don't know what the
yes, we do, Ingrid.
Would have looked like with the EU. No, we don't, because
there wouldn't have been one. There's the answer to that question. Yeah.
No, okay. Well, it's a discussion for another day.
Yeah, okay. But thank you, Ingrid. You have a very good weekend. Nice to talk to you, and we'll see you again next Friday. That is Ingrid Leary, the Labour MP for Tairi, and we sort of wrap up a week. And as always, people who'd like to comment on what has been in that interview, you're most welcome to do so.